So my name is Estela Barbosa and I am a data scientist at RSI. So we collect lots of data on the women who are referred to the IRIS programs. So we collect information on their ethnicity, on their age, on whether they have children that live at home, whether they're pregnant, if they have a mental health condition or any physical health conditions that they might want to report. We also collect information on their religion and on whether they consume alcohol and drugs, if they have a disability. So there's lots of information we collect on the service users. So I think the most important thing about women who are referred to the IRIS programs is that they are in general older than women who are referred to specialist services. So women referred to the IRIS programs are on average 39.5 years of age, which is slightly older than what's reported elsewhere. So since 2010, for example, about half of the women referred to the program were aged between 30 and 49, and we also have 21% of service users being aged 50 or more, which I think is a very interesting aspect of or characteristic of the women who are supported by the IRIS program. So while, for example, 50% of the women report being white British, there's a lot of variation across the UK. So, for example, in the West Midlands, around a third of the women are Asian, and in London, about a quarter, so 25%, are Black, African, or Caribbean. And I think this is really interesting because it goes to show how diverse women who are referred to the IRIS programs are. So some other things that I find interesting is that about half of the women report having children under the age of 18 at home, and 3% of women who were referred to the IRIS program were actually pregnant at the time of referral. So I think it's really important that we look at some health characteristics of this women. So, for example, 60% of the women, so 3 in 5, report having a mental health condition, and most commonly they report having anxiety or depression. But it's also interesting that around 37% report having a physical health condition like diabetes or obesity. So we can see that there is a relationship between being exposed to domestic violence and abuse and mental health. I also find it very interesting that we have around 13% of our service users disclosing a disability. This is slightly lower than what the WHO says is the prevalence of disabilities in the population, but it is still pretty close. So while the WHO says 15%, we find 13%. So I think that's an important characteristic of the women the IRIS program supports. Now, on top of that, there's a lot of variation, for example, in terms of religion. So we have around 40% of our service users reporting having no faith, which is much more than in the general population. We also have about 30% reporting being Christian and 20% report being Muslim, and they both seem to be a little below what the average of the general population is. So I find all those things very interesting. I think that going forward, one of the things we might want to explore is the intersection between things. So understanding, for example, if there is a higher prevalence of disability in a certain age group or in a certain ethnicity, and this is still work in progress.